The video series Diabetes Educator was developed by the Georgia and Oklahoma Academies of Family Physicians as part of the Go Diabetes Initiative. The Diabetes Educator series consists of 6 video vignettes, each outlining best practices in the care of diabetic patients. Please proceed to the registration page for more information on the approved number of prescribed credits for this activity, as assigned by the American Academy of Family Physicians, and AMA-PRA Category 1 credit as assigned by the Georgia Academy of Family Physicians. Upon completion of each video vignette, please return to the Resources video page on the Go Diabetes website to complete the activity evaluation and earn your CME. This activity is supported in part by an educational grant from Sanofi Aventis. We thank you for participating in this online activity and hope that it serves as a valuable educational tool.
Taking medications. I have lots of issues with this because like I told you, I work with Latino patients, and my patients have lots of little quirks they do with this. You have to make sure that your patients are doing what? Taking it. So just because your patient kept coming back, and that insulin, my God, it took me forever to start them, and it's just not working. Let's keep going up. Let's keep going up. Take a breath, stop, and ask your patient, how's it going? Show me where you're taking it. How are you taking it? You'll definitely, don't ask me, are you taking it? Because what's my answer? Just find out what's happening. I've had a patient the other day. She was on Lantus, I don't know, 18 units. And I started going up, 3 units, 2 units every 3 days if she was over 180. Took me a month. It wasn't dropping. I brought her in. I asked her to show me. I changed her injection site. She was doing it. But I was totally doubting if this woman was if she even had a bottle of insulin in her home. So you really need to take a look of what is happening. Brought her in, had her show me, where do you take them? Let's go from here to here. I went to a site where, it takes longer because I was basal. She was taking it once a day. We finally got her working. So make sure that you're finding out how many times a week is your patient missing the doses. Because you always assume it's not working. Keep in mind that it may be that your patient is forgetting to take it, not on purpose. Life gets in the way. Are they refilling? Do they know they need to refill their prescription? Do they understand the actions? They have a stomach upset with metformin. I'm allergic. I don't want to take it anymore. Talk to your patients about that. Reassure them that metformin is going to cause this. Start slow. 500 once a day until they can tolerate it, and then increase as needed. Don't go straight to 2 grams because that's going to kill that stomach. Problem solving. I told you that this was important. I think you need to be aware if your patients understand. If you teach somebody how to treat hypoglycemia, it's not going to happen the way you taught them. It's going to happen totally different the day it happens. They need to be able to use your teaching, critical thinking, and apply it. So find out how your patient, maybe I'll encourage you, think how you solve your own problems, and then work with your patients on how can they utilize some of this knowledge to really apply it. I have been using some scenarios in my patients in class and letting them as a group come up with solutions. So I tell them, okay, this happened to you today. You woke up, you are sick, and your sugar is low or high, or whatever. And they as a group, okay, we need to check, we need to do this. We make sure, so they start putting in practice the different things they have learned. Reducing risks. We've heard about all the microvascular or macrovascular complications. You need to make sure your patients understand. They're afraid. Again, I'll give you an example of my Latino community. Most of their family members have diabetes. They've gone blind. They've lost their legs. They're terrified of using insulin because they think insulin is what causes it. But they just think it's going to happen. They don't think there's anything they can do to avoid it. And they need to be explained about the importance of self-management support and what is their responsibility in avoiding these things. And again, make sure that your patient is coming back to see you and they're following your instructions. Healthy coping. Living with diabetes is tough. It's every day, it's every minute, is no vacation. Everything you do affects your blood sugar. What you eat, your activity, your emotions. So you gotta understand that's very easy for us as providers to sit here and tell you what to do. But when you're the one living with diabetes, it just becomes a whole different story. So find out what your patients are going through. Understand if they've gone through the acceptance process, are they still in denial? You know, that A1C test was wrong. I ate that morning. Whatever it is, find out where they are and deal with them, moving them through the acceptance process. So as diabetes educators, this is what we will do. We let the patients make the choice of what we're going to work on changing. Because let's say that you know your patient's smoking and you think they need to quit smoking, but they are ready to start exercising today. They got the shoes, they got the membership, they're ready. I would mention, you know, you need to quit smoking, but those 2 minutes I have, I would probably spend on explaining the exercise routine and what they should do and things they need to know about that. So you want to make sure that you go with what your patient's choice is. You want to specify the problem. You need to identify as part of your assessment what are the high priority problems that need to be addressed. You're familiar with setting SMART goals? Perfect. Identifying barriers. What are the barriers to doing whatever you're asking them to do? Money, willingness, readiness, whatever it is. We like to agree in writing. We used to do contracts, but contract is not what we do anymore. But you should talk to your patient. This is what we're going to do, and let's write it down. There's no need to sign it like we did in the past. But writing it down allows you to understand what is it that you're doing. My patient may say, oh, I just want to get my diabetes under control. Yes, I do too, but that's too big. What are you going to do to get your diabetes under control? What can we find in your eating or in your exercise that you can do? I'm going to exercise more. Okay, I need more than that. Okay, I'm going to exercise twice a week. I'm going to walk around the neighborhood with my husband, and I'm going to do it when I come home from work. That I can take. We'll write that down. Very specific. We can see if it was done. But I'm going to get my diabetes under control. Where do I start? So that's how we do it. You identify successes. Start with identifying successes. Even if it's tiny, find it. Find what they did well. They came back to the appointment, although they knew they didn't do it. And find out what were the barriers and how you can help them. Track the outcomes. One of the new things is collaborative goal setting. Imagine if there's one patient, and there's a lot of us working with that patient. We're all asking that patient to do something different. One of us wants them to quit smoking. One of us wants them to take their meds. One of us wants them to lower their cholesterol. One of us wants them. What does the patient want? And we all agree on what that is, and we all worked on that. We could get them to goal and move to the next. But right now, the patients are totally confused with us asking them to do too many things. So I would encourage you to work on setting some goals for behavior change for your patient and letting everyone in your team know what it is. So it should be part of the chart. So your MA or whoever takes the patient from the waiting room to the scale, they could start talking about that. Look at the chart. How is this going? Were you able to do it? So everyone addresses the same issues. That will work beautiful. You track the outcomes, and you plan for relapse prevention. We all know it's going to happen. It's very difficult to maintain behavior forever. I love my patients when they come and tell me, what are you eating for breakfast? Salad. Okay, very good. How long are you going to eat salad for breakfast? For 40 more years? No. Let's go find what you like to eat for breakfast and let's just do it right. You know, they're so willing to do it, but that's not going to stick.